How dangerous is liver abscess actually?
Liver abscess can actually kill. It can present with fever, tummy pain, and things like that. The trouble is that we may not see it. So, face very important, right? So sometimes I got a big pus down here. I call the plastic surgeon. Hello, come down and cut. Then my patient said, "You crazy? You spoil my beautiful face."
Welcome to Dr Leong Hoe, our medical podcast where we discuss medical topics in a fun, simple, and entertaining way. I'm Dr. Tony Budi, and today we have a very special guest, an infectious disease specialist, very famous one, often seen on TV, but now he is here with us in this humble studio. Let's welcome Dr. Leong Hoe Nam.
Tony, thank you very much. I've known Tony for quite a few years, and it's a pleasure. I see his videos. It's really a pleasure to join him here.
Thank you. Okay, Dr. Leong, what are we talking about today?
I want to share with you about liver abscess because liver abscess is something which we see quite a lot of.
Yeah.
Number two, I think someone recently had liver abscess and the person has posted on the internet about this. So liver abscess is a condition that can kill. And I think this is a wonderful opportunity to share with other people what are the signs, why it happens, and things like that. And at the end of the day, it's about preventing the next illness or identifying them early, and then we get treatment.
Yes, that's right. Liver abscess. So sit back, relax, and let's get started. Why did you choose to be an infectious disease specialist? Can you tell us?
So number one, I'm not as smart as Tony. You see, the very smart people will do surgery. Number one, they make more money. Number two, you have to be smart to be a spine surgeon. I'm the sort who just likes to think about problems. So infectious diseases is one of those where you think about problems. It's like what the Chinese will say, the 军事, the military strategist. So Tony will be fighting the battle in front. Then I'll be thinking at the back, maybe you should do something else. That kind of strategist. So I don't really wield the sword or the knife and I don't cut. But infectious disease, you plan and then try to get things going.
Okay, for our listeners, if you have any questions along the way or comments, feel free to type it out in the comment section below. Okay? Dr. Leong, normally when we talk about abscess, we talk about buttock abscess or skin abscess somewhere or pimples in the face. But liver abscess, how does it come about?
You see, the pimple, buttock abscess, usually something outside touch inside. So, but liver abscess is actually pus inside the liver. Something must have delivered the germs to the liver. It's often the gut. The intestines are the source of it. So we all eat rubbish. The rubbish goes inside the gut, and in turn, it actually presents itself into a problem in the liver.
Yeah. When we eat, right, then it go absorb whatever we eat. It go absorbed and is screened or filtered by the liver first.
Spot on. So in fact, the blood supply of the gut is that they don't rush to the brain and to the heart straight away. It goes through the liver. The liver will have a filtering mechanism. It goes through, all the germs will filter. Good guys, bad guys, good food, bad food. Too much fat, take away. Too much sugar, take away. But sometimes the germs go through. When that happens, it lodges itself inside the liver structure. It's like a netting, catch, and then after that, you get infection.
Is that why liver abscess is more common than any other intra-abdominal abscess?
Spot on. The liver blood flow is really a lot. And let's be honest, we also eat quite a bit of nonsense. And as we grow older, we'll talk about it later on, our immunity comes down a bit, and in turn, we are more prone to this.
How dangerous is liver abscess actually?
Liver abscess can actually kill. It can present with fever, tummy pain, and things like that. The trouble is that we may not see it. We don't know. You get fever, you may have tummy pain, or you may even have no tummy pain at all. And you just don't know what's wrong. If you don't think about it, even a blood test may not show. At the end of the day, you may need to do an ultrasound or CT scan to pick it up. So it's not easy and it can hide very, very well.
How common is liver abscess?
Liver abscess as a cause of fever is actually quite uncommon, probably less than 1%. But it's one of those which will take you to the hospital, even the emergency department, saying, hey, I'm feeling very, very unwell. Something is really wrong with me.
Just now you mentioned that some people with liver abscess, they don't present with abdominal pain. Then how do you know that it is from the liver? Abscess from the liver.
So this is where the doctor has been really smart. You ask about the fever, the symptoms. Sometimes you get a bit of tummy pain, nausea, but often you don't. And then we would like to screen the urine, do the chest x-ray. And when you can't find anything else, you start looking at the liver. And this will mean you have to do a scan because you can't feel the liver very well. It can be an ultrasound scan or be a chest x or a CT scan. And then you actually pick up the liver abscess.
Do they present with jaundice like people with other liver problems?
Majority do not
Really,
present with jaundice. By the time we get jaundice, it means that a lot of the ducts are obstructed. The patient is actually quite advanced.
Okay, so that's why need a very clever infectious disease specialist to figure out lah.
You need someone to think about it. You think of a problem, you look for the solution.
Yeah.
But if you don't think about it, you don't look at that way, you won't find it. So liver abscess, people tend not to think of it, look for it, and one day you'll find it.
Is it always caused by infection or can it be non-infective?
Most of the time, it is actually infective. In fact, more than 90% of the time is due to a germ called Klebsiella. So a little bit more atas and more difficult things. Asians, Singaporeans, Indonesia, Southeast Asia, as far as up to Taiwan, we tend to get this germ called Klebsiella. And this Klebsiella is quite strong.
Okay.
It's because of this bacteria that it tends to cause liver abscesses inside our liver. Okay, so it's quite unique to us in this East Asian population and Southeast Asian. It's this germ with this propensity to cause liver abscess.
Where do we find Klebsiella usually?
Klebsiella is found in the colon, the usus, and then the germs will be growing inside there all the time.
Okay.
So you take my feces now or Tony's one, you'll find Klebsiella there, but one of them may cause trouble later.
For our listeners, we would love to hear from you. If you got questions, thoughts about what we discussed today, drop them in the comment section below. Is there any group of people who are at risk of developing liver abscess or abscess in general?
You see, the liver, when God created the liver for us, He actually made it a very, very good system, a lot of protection in place. But as we grow older, our immune defenses will come down. So the older age group is a problem. Then you realize that the structure of liver is to actually try to prevent infection. But the structure goes a bit haywiring, like liver cirrhosis. Then you are more prone to it. So liver cirrhosis is another one. Some people get cysts in the liver, especially those with multiple cysts. Polycystic liver disease, they're also more prone to it. Do you know about gallstones, gallbladder? Because the gallstones and the gallbladder is just next to it. If next to it there's a bit of a ruckus, a little bit of an infection, it's very easy for the germs to keep spreading into the liver. So those are some of the conditions. Well, before I forget, kencing manis.
Yeah.
You got diabetes, your risk of getting liver abscesses are much worse.
In terms of lifestyle factors, like diet, hygiene, do they have any effect on increasing the risk of developing liver abscess?
So the very important thing is this, you look at Tony, look at me. Go for Tony shape. Don't go for Leong Hoe Nam shape. You go for Leong Hoe Nam shape, you are a problem. A problem because you are prone to diabetes. A problem because, and then with diabetes, you are prone to many problems. Besides liver abscess, infections in the lung or urine tract infections, you get many other issues. So go for Tony shape. Wrong shape, right shape.
What about eating raw food, like eating sushi, sashimi, or rare
beef or something
rare
like that.
beef or steak?
For the general population, it's actually fine.
Okay.
If you can, eggs for example, the eggs telur actually can have a lot of germs inside. most of the time it's fine. But if your immunity is goya, you got liver cirrhosis, your immunity is no good from steroids, etc., it's a problem. Diabetes, your diabetes is terrible, even simple raw foods will be an issue. Now, I want to touch a little bit. I tell you, my Vietnamese friends will be angry with me. So, in raw food, there's one kind of parasite affecting the liver. Okay. It's called the eosinophilic liver abscess. It's caused by parasite. And in Southeast Asia, one particular place has it most. It's actually the Vietnamese.
Oh.
In the Vietnamese cuisine, they love to serve this watercress, but they don't cook the watercress. And this watercress comes from the freshwater pond. They take it, wash it, and then put it on top as a salad, which you take.
Oh.
The trouble is, down there are little snails and the eggs which are on the watercress, which you may not be able to wash it off.
Wow,
You
interesting.
eat it, then the parasite will go into the liver and then jam up the ducts and cause liver abscesses. So this is a form of liver abscess that's quite unique to our region. It's found in watercress, which is commonly used in some of the Vietnamese dishes. If you cook it, it's fine. The thing is, you don't cook, there's a problem.
Not watercress in Singapore.
No watercress in Singapore. This is a freshwater watercress.
Okay. Just now you mentioned if we eat sashimi, raw food, raw steak, medium rare, it's okay if we are healthy. So if people with diabetes, they have liver problem, liver cirrhosis, or polycystic liver disease, your advice is not to eat raw food.
So people poor immunity, liver disease, etc. is what Tony has said. Usually I don't encourage them raw food. Even my parents, once they cross 70 years old, I say the morning eggs are half cooked one. They said no more already. If you really, really insist on eating your half raw cooked eggs, you must get those eggs that are pasteurized. Pasteurized eggs, which you buy in the atas supermarket, you go into the fridge and get them. It's more expensive. There you can take it because they killed the germs before.
Yep.
But most other eggs carry a risk of germs. It's just not worth it.
What about stress or poor sleeping habit? Do they have any effect or increase the risk of developing abscess in general or infection?
Stress in general will cut down your immunity. When you don't sleep well, your immunity comes down. You're more prone to infections. But as a number altogether, if you take all the numbers together, the risk is actually not a lot higher. So you cannot blame your liver abscess on your boss. Obesity, not really. Obesity is quite fine as a risk factor, but I would be cautious because of obesity, you tend to get diabetes mellitus.
Okay, for our listeners, we want to hear from you. Any questions or thoughts? Share them with us in the comments below. For liver abscess, is surgery a must?
Great question. I orang tua doctor already. When I was young doctor, we actually subjected many of them to surgery. And it's terrible. Because you imagine you open one big cut here, potong already, you potong part of the liver come out, you lose a lot. And then it takes a long time to heal. So we don't like it. So what happens the last 20 to 30 years is they created drains. Drains under ultrasound, they go inside and suck out the pus. You suck out the pus, you have very little injury to the nearby liver. Not only number one, you suck out the pus, it's like all the naughty guys, you suck them out. So less naughty guys to kill. Number two, you actually know what's the name of the germ, you target it, it's better, you know what antibiotic to use. So the drains have made a big difference. In fact, in the last 20 years, I've only made 2 people go through surgery because they were not getting better or the circumstances were very, very difficult. But everybody else, it was just drainage, and it works beautifully.
So the standard treatment for liver abscess now is drainage and antibiotic.
Actually, now antibiotics are so good, sometimes we may not even need to do the drain. Okay, so that means you just give good antibiotics, infection markers all coming down, no more demam, the guy is walking around very happy. They say, okay, you just take antibiotics, that's it. If the fever is not coming down, then we actually put in a drain.
I'm also treating abscess in the skin, not in the liver. We always cut them out and drain the abscess. We don't put drain, we just cut it out. Sometimes we get asked by patients, big abscess, can you just stick in a needle and take it out? I say no. But for liver abscess, it works.
It works. It works.
But do you think it works for, I never tried for like superficial abscess.
Actually, it may work, depending on circumstances. So face very important, right? So sometimes I got a big pus down here. I call the plastic surgeon. Hello, come down and cut. Then my patient say, you crazy, you spoil my beautiful face. Then what they do is, they'll use a very small needle, go in there and suck. So they may have to suck once, 2 times, 3 times, and suck out as much of the pus, whilst I use antibiotics to push everything down until everything settles nicely. So we have done it before. Primarily is to save the cut. But if you think about it, we don't like it. It's slow. I have to use more antibiotics. If it's okay, I just take it out. A few more days antibiotics and its job is done.
We come to the last part, which is fact or myth. So I will mention around 10 statements. I want you to say whether it is fact or myth or half fact, half myth with short explanations.
Sure.
Okay.
The audience can also participate. You score yourself and you tell us what your score is.
Yes, make sure you answer correctly the way Dr. Leong Hoe Nam answered.
Answer truthfully and no cheating.
Liver abscess always presents with abdominal pain and fever.
False. Okay, you can just present with fever or just present with pain, nothing else.
Drinking too much alcohol can cause liver abscess.
Well, that's a yes and no. Pure alcohol alone, no. But if you're drinking alcohol persistently for a long time and you have liver problems, definitely you can get liver abscess.
Liver abscess can spread, can become life-threatening.
Liver abscess can spread out of the liver into the blood, going into the lungs. Yes. So the answer is yes, it can.
It can kill you also.
It can kill.
All infectious diseases are contagious.
No. A lot of the infectious diseases are not contagious.
Yeah.
We're used to COVID, influenza, etc. But things like Klebsiella, Staph aureus, no, it's not.
When we use the word contagious, actually, what does that mean?
Contagious, it means can spread from one person to another person and cause infection on the other side. So COVID is a very good example. It's contagious. I can spread from one person to another.
Okay.
Dengue fever, no. Dengue fever is me. I can't spread to the other person.
Okay. Unless got mosquito bite you.
Or mosquito bite or something a little bit funny. But this one another video. Go and ask him. It's called sex.
Really? Dengue?
Dengue can be transmitted by sex?
Wow.
Okay, so don't trust my word. Google search dengue transmitted by sex. You go and find out for yourself. And then ask Tony, make one video.
Wow. I cannot speak about that. Must invite you again lah.
No. Most people can talk about sex. It's okay.
Viruses can mutate and can become more dangerous.
Yes, that's true. A lot of viruses mutate. They want to mutate because when they mutate, they evolve and evade the existing immunity.
Once you have an infection, you are immune for life.
Not quite true. For many infections, you can be infected with the germ again and again. So I would say it's a no. You can kena infection again and again and again.
Hand sanitizer is more effective than soap and water.
Actually, both are very effective. Why do we like hand sanitizer? It's because it's easy to use. You want me to travel all the way there to the sink to wash? Troublesome. Use alcohol fast, quick. So both are just as effective.
Vaccines can weaken your immune system and can give you the disease that they are meant to prevent.
That's a no. The vaccine is just a weakened form of the virus or the bacteria. They added a little bit of salt to make it more tasty for the immune system and jab it in. It's like me. Okay, for example, you chop off my head and you train the body, the immune system to recognize my head. Can my head wake up and then start attacking people? No.
Natural immunity is better than vaccine-induced immunity.
For most intended purposes, they are about the same. But the problem with natural immunity is, in order to get the natural infection, you have to survive it. That means you fall sick, you feel lousy, you have to survive it. For the vaccine, you don't have to worry about it. Most people are fine, and then after that, you learn how to overcome it. It's about falling sick with the natural infection that makes you worse. Vaccine, most people, 99.9%, take it with no issues, and you learn how to cope with it.
Vaccine can cause autism.
The answer is no. Clear cut, no, vaccine doesn't cause autism. We're seeing a lot more autism cases now. In part, school system, so stressful. Those people with autism will not be able to cope. Number two, we have better diagnostic capabilities. Doctors are able to diagnose autism, so we see a rise in numbers. But vaccines don't cause autism. Now, all this idea about autism comes from a silly study which was fouled up, which was messed up. The person who did the testing created and massaged figures. Massage accounting figures. You massage until you get a positive result. That study has been revoked and removed. So vaccines don't cause autism.
Wow, that was such an insightful discussion about liver abscess. Thank you so much, Dr. Leong. Before we wrap up, would you give the listeners a short take-home message of what we discussed today?
It is now an incredible era where we can actually live such a good long life. And with good control of our existing disease from diabetes, our liver health, and our general health, taking vaccines, we can lower down all this risk of different infections, including liver abscess. Liver abscess is a real threat to us in Asia and all around the world. If there's fever and you're not well, go and see a doctor. If the doctor can't find anything wrong, ask the doctor, Doctor, Lokun, can this be a liver abscess? And remember, you learned all about liver abscess first at Tony Sathiobuti's YouTube channel.
Alright. Okay, that's all for you today. Thank you for joining us. And to our listeners, if you found this episode helpful, don't forget to like, subscribe, and share it with your friends. Stay healthy, and we will catch up with you again in the next episode of